Hello. As a registered nurse or someone who is taking a position of band 3, 4, or band 6, one of the things you need to understand in your interview or what package you need to look into or area you're going to think questions are coming from is from three set of questions. Three set of questions. What are the three set of questions? The first one is clinical. Clinical. The second one is education. The third one is research. So now, what are the practical practice as a nurse or a registered nurse on the ward? How do you cover this thing while you are at work or practice during your 6 months or 1 year in practice? The first thing you need to understand when we talk about clinical, how do you assess your patient, your job role? How do you engage in the clinical activity? What evidence do you base them on when you are doing it? Say, for example, you're talking about individual patient diagnosis. What evidence do you have that this patient were really diagnosed by who, when, how long, and what treatment is required? What evidence do you have that, okay, you go into the clinic, that the medication you are administering, that this medication has gone through MDT, multidisciplinary team, right? Do you understand the values of NHS when it comes to care plan, when it comes to compassionate care, when it comes to patient-centered care? So your principles of safe medication, it goes on to 5 rights. However, it's beyond 5 rights. So when it comes to administering medication, you need to think of patient-centered care. So these are the first approach you need to base your clinical practice on. Also, what kind of assessment level do you have when it comes to neurological assessment? When it comes to news observation assessment? How do you know if your patient is okay? Do you have patient who is self-harm? Do you have patient who is lonely? Do you have patient who's having diagnosis of depression? How do you manage this, your patient? What kind of environment do you think this patient will be fit in when it comes to assessing patient coming onto the ward? Do you think this patient can live with other patients on the ward? Do you think other patients need to be discharged? What kind of risk assessments have you done to safeguard all the patients on the ward? Your staffing, how many staff do you have on duty? What are the skills? What kind of professionalism and trust do you have between the staff on shift? It might be the same level band. However, what kind of trust do you have? There are things you don't know. You don't have to be perfect. Do you have any other team on shift or numbers you can call when you need to get some answers? Because as a lead team, you should have answers to every question, not because of your knowledge or based on your knowledge, but based on evidence, evidence-based practice. So that is where we now talk about education. Look at your mandatory training. Have you done your induction? Have you reviewed your induction in the work you are doing? Do you come into this place without knowledge? Now, you have chances to go through induction, mandatory training. Have you completed your mandatory training? There are areas, you know, when we talk about your strengths and weaknesses. Have you managed to work on developing yourself to close the gap? Or to target the colleagues that, yes, you have managed to gain this education now. You know how many kinds of staff we have. Uniform-wise, What are the identity you need? The name badge. All these things are very important to keep you intact when we talk about the role of nurse on the ward. So now we go down to research. The research is unlimited. So now, if you remember the COVID-19, lots of research were done fast to bring out vaccine. However, that is not enough for you to say, yes, it is done now. You have to continue your research. What of the diagnosis, the side effects? What happened there? How do you manage to look at your BNF, your NICE guidance? Are they still available intact? Is it because you just finished your uni? They are no longer in place? No. So now, when it comes to your interview, all these things can come up. There are some scenarios that will come up. Okay, patient come onto the ward now that is being admitted. As a nurse in charge, what is your role? You might have a patient who is self-harm, high risk of self-harm. And this patient is coming in with their property. One of their property might have something, when we talk about maybe toy or something, you actually know that this toy can harm this patient. But on the other hand, this patient just came onto the ward and is depressed. And you go into the office and find out there is one of the toy the patient is holding, which is this particular toy, that this toy are part of the thing that calm the patient down. And this patient coming onto the ward, there is high risk that there is possibility that this patient is not going to be maybe calm, or this patient is not going to be easily entertaining when it comes to new environment. Getting familiar with the ward, getting familiar with their room, getting familiar with every other patient on the ward. Or maybe their staff they don't actually like. Have you managed to find out what is their pronoun? Some of these things can trigger your patient first time they coming onto the ward. So now, in this type of scenario, the first thing you need to look out for is their care plan. And what staffing method do you have? So the first thing you need to do is to put this patient on eyesight, one-to-one, and also look at the risk in terms of violence. If you need 2 staff, also look at the risk in terms of safeguarding. If you need 3 staff, check the environment. Do you have camera on the wall? Check the area you don't have camera. Put 2 staff there for eyesight to make sure this patient is safe. At the same time, you are not going to get any staff suspended, because that might actually increase the risk for the patient not having enough people to look after this patient. Not because you want staff to be on shift because they're going to pay overtime. No, because you are patient-centered risk-making decision. Yes. So as a registered nurse, there are different packages you need to go into. In review, we talk about education, we talk about research. Now, we also talk about clinical. So this 3 area is something you need to look into when it comes to registered nurse role on the ward. Yes.